Welcome back. It's time for our Africa Health Network update. Linord Moudou is here with today's reports. Welcome, Linord.
Hello, Vincent. Hello, everyone. The United Nations Children Fund, UNICEF, says Niger had the greatest number of malnourished children in the Sahel region in 2012. More than 330,000 children under the age of 5 has been at risk of malnutrition after harsh drought and high food prices. But a recent study in the medical journal Lancet says the country has also nearly halved the death rate of young children since 1990. More health centers in remote regions have been opened, and trained staff posted in various clinics give mothers talks on how to improve their children's diet.
Locusts destroyed our crops last year. There was nothing to eat, and I had no more breast milk for my daughter. We've learned about the importance of breastfeeding and making other important foods for children, like beans and peanut butter, enriched porridge, and other foods.
When children arrive here, they are already in a critical state. If you look at the mortality figures here, you will see they total to no more than 5%.
And experts also say the use of treated bed nets, improved nutrition, and vaccination have helped reduce death from malaria, pneumonia, diarrhea, and measles. Now to Tanzania, where mothers are getting some support from one of the world's richest men. Michael Bloomberg is the mayor of New York, a billionaire and a major donor when it comes to maternal care.
The UN Population Fund, UNFPA, says a woman dies every 2 minutes of pregnancy-related problems. 99% of such deaths occur in developing countries. Some common causes are bleeding after childbirth, high blood pressure, infections, and unsafe abortions. Recently, at a news conference held at the UN headquarters, billionaire and New York City Mayor Michael Bloomberg announced that his foundation is funding the expansion of a pilot maternal health program in Tanzania. The program is predicted to help 50,000 mothers and their children during the next 3 years. Data shows that Tanzania, along with many countries in sub-Saharan Africa, will not reach a UN target of reducing maternal death between 1990 and 2015 by 75%. President Jakaya Kikwete of Tanzania.
A lot of ground has been covered and a lot has been achieved, but we need to scale up efforts because still too many mothers and children continue to die or are at risk of losing their lives.
The Bloomberg Philanthropies Maternal Health Program began in Tanzania in 2006. The initiative trains assistant medical officers and midwives in remote areas to perform life-saving procedures such as cesarean sections. It also includes upgrading isolated health centers. Bloomberg has now joined forces with Geneva-based H&B Europe Foundation to spend $8 million to expand the program over the next 3 years. This will amount to $15.5 million that has been spent since the program started.
It's easy to get capital once you have a proven model. That's hard at the beginning. So I think her foundation's donation and Bloomberg Philanthropies donation hopefully will be just the beginning. And it would be wonderful if you saw the world turn out and dwarf what we've done so far with other monies, but using the model that we think will work.
Bloomberg says some simple interventions could save many mothers' lives.
100,000 women are going to die, and they've been doing this since time immemorial and giving birth. We just have to try new things, and the practicality is that a lot of simple things can cure those things. You can stop smoking. Doesn't cost anything, saves you money. You can stop overeating or change your diet. Doesn't cost anything. You can use, if you have to, a razor blade, a piece of string, and a little bit of rubbing alcohol, and save an awful lot of those 300,000 lives.
Bloomberg Philanthropy says the maternal health program in Tanzania has trained more than 100 local non-physician clinicians, including assistant medical officers and nurse midwives in the East African nation's most isolated areas. More than 1,000 babies have been delivered by C-section in villages, preventing some women to travel several hours to receive care.
And that's our Africa Health Network report for today. For more health news and development, be sure to visit our website, africahealthnetwork.com. Vincent?
Well, thank you very much, Linord.